I think we're probably seeing a move towards therapies that modulate the immune system. It's not, I wouldn't say that they're crazy because they have been traditionally used in skin conditions. So, for example, like the autoimmune kinds of skin conditions like psoriasis. We as doctors, we do use disease like very toxic drugs, like pretty much cytotoxic drugs in these conditions. So you might say they're crazy, but because these autoimmune conditions don't just affect the skin, they also affect joints, and they also affect nails. They also can affect internal organs. So the severity warrants a certain level of treatment. But I think because we're now understanding that some of these conditions are autoimmune related, we've become much more interested in looking at the immune system as a whole. So there are definitely interesting therapies that are out there. And one of the interesting things that I'm seeing is the use of peptides in skin.
Yeah, right.
I mean, that's been around in the cosmetic industry for a long time, where you have peptides in topical creams and skincare products, and then you apply it.
Yeah, I've seen this before. Yeah, okay.
So you've probably seen that in those areas, but that research has been around for quite some time, and we're now becoming more refined in the kinds of peptides that we have access to. So now they're injectable forms, and some of these forms actually have specific signaling mechanisms. So if we go back to what peptides are, they're chains of amino acids, not more than 50 strings altogether. So some are smaller, some are larger, and they actually in our bodies are natural. They occur naturally. We have them, and they're signaling messengers. So they send messages to our cells to then replicate parts of the DNA to then have an action. So these are signaling molecules, and in the general health industry, so we're talking about disease treatment, a lot of the research is being done in cancer therapy. But if we're talking about in skin, there's actually a lot of these peptides that are now injectable into the skin.
Wow, okay.
So one of the really interesting ones for anti-aging is copper peptides.
Yep.
So copper is something that is important for skin repair, skin signaling. It's important. It's a really important molecule that helps the skin to repair itself. And so we see a lot of that in skincare products, but also in the form of injectables. So other peptides also, there's so many of them, and they're all they're all oligopeptides, different numbers, different ones have different signaling cascades, but some actually help to reduce the overactivity of melanocytes. And the reason is because in Asia, I see a lot of people, Asian skin tend to have a lot of post-inflammatory hyperpigmentation or pigment disorders, just because our skin type is much more sensitive to UV radiation. And as a result, melanocytes are created to protect the skin. So, and they tend to stay for a lot longer. There are also congenital types of skin conditions called nevus of Ota, nevus of Hori, that are not life-threatening, but they are a cosmetic concern. So there's a lot of research into these products that are blocking the production of melanocytes, but also the melanocytes themselves have melanin that transfer pigment into the layers of the skin. So there are specific signals using peptides that we can send to those pathways to block it.
Wow.
So it's a really interesting area of research.
That's super interesting.
Yeah.
And it seems to me that one of the cool things about that is that we're still using what seems to me, I mean, correct me if I'm wrong, because sometimes I am, that we're still using naturally occurring substances in a sense to have a more, I guess, specific, target.
Targets, yeah.
And I think this is where I'm actually loving a lot of these directions where we're gaining new understandings. And I really just wanted to pick up on something you mentioned just before, in that, even with peptides and some of the more specific kind of targeting that you're looking at, you've just really ticked a box there in saying that, hey, the immune system's now really, really important. And our knowledge and application of how we can help the immune system seems to be that, okay, well, you've got an autoimmune condition, maybe the cream's not going to cut it. You know, maybe we need to modulate the immune system a little bit more and then kind of, you know, move ahead with actually, I guess, what I heard was the origin story of why that's happening. But are there any other areas where peptides have been? I'm super curious. Are there any other areas that you've heard that peptides can help people?
I think other areas, for example, are probably a lot of the research that's been done is in athletes, because the kinds of peptides that often, I think because athletes are also the types of people who need to recover really fast, and because they're also stressing their bodies at a much higher rate, then the search for things that will help improve recovery and also shorten the time of injury has been quite of interest. So there are definitely peptides that help to improve joints, connective tissue, ligaments, fibroblasts. So it can even cut down the time of the athlete needing to recover. So there are different kinds of those peptides around, and some are oral. So not all peptides need injections, but they're oral. And I'll have to say that even for skin, you can take certain peptides orally. And that's actually been around for quite some time. Okay. But the initial hypothesis was that, like collagen peptides, that whatever collagen you ingest actually goes to the skin, but it actually doesn't, because the collagen is a signaling molecule.
I'm glad you brought that up. Yeah.
So there's a lot of confusion. People often ask, is there any benefit in, orally consuming collagen? Does it go to your skin? Well, what you consume doesn't go to the skin, but it signals the skin to make better ones. So that's really the short version of it. And collagen is actually not just in the skin, it's in the gut, it's in our joints, in our connective tissue. So there are different types of collagen. So I think that's probably an area of further research, because we're much more able to pinpoint and refine and purify peptides and really target so specifically the signals that we want to switch on.